Perfect. All right. Well, good morning, everybody. I think we're ready to get started. We appreciate you all joining us for what I hope will be some lively discussion about how we move forward with our employees and workforces across North Carolina, specifically with those who work in the hospitality industry, and how we create environments that are safe and welcoming to our employees and provide best practices for keeping those employees engaged and happy and healthy during COVID-19. I'm Lynn Minges. I'm president and CEO of the North Carolina Restaurant and Lodging Association. And this session today is being recorded. I always want to tell folks that. There is an opportunity for you to ask questions during this session. And I think the chat box functionality is also in place. You can use that. But we'll try to keep this fairly informal since we don't have a huge number of folks on the call today. I think it'll be manageable and we can just have some really engaging dialogue. I've been asked to begin this morning to share a little bit with you about the impact of COVID-19 on the hospitality industry. No surprise to many of you all, COVID-19 has had devastating impacts on restaurants and hotels across this country and across the world for that matter. In North Carolina alone, we have just been reeling from the impacts. We were an industry that was growing and thriving. There were new restaurants opening every single day in communities all over our state. Hotels were opening. Nearly every business owner and operator I knew was in expansion mode. And the employment in our industry was growing and thriving, as was payroll. And all of that sort of came to a screeching halt in mid-March, when restaurants were required to shutter for indoor dining, and the stay-at-home orders went in place as a part of COVID-19. We're now some 34 weeks into this pandemic. We've seen some improvement, but still we are really struggling. And as we look out into the future, we just don't see a whole lot of change coming until we embrace that change and make that happen as an industry. So that's a little bit about what we're going to talk about today. I will tell you, as we look at sort of the state of things, hotel occupancy around the state remains below 50%. To keep in mind, hotels are not profitable. They probably they're making some profit at 50%, but as occupancy, remains below 50%, they are not a viable business. And so I'm very concerned about hotel operations statewide. We're concerned about restaurant operations that are down still, or through COVID-19, the entire period, about 23% roughly in gross sales. Many of them have been able to pivot and adapt. They put in place, carry out, takeout, delivery systems. They've enjoyed outdoor dining during the warmer months. But as we head into winter, a lot of that's going to be changing. But we're still struggling as an industry. In terms of employment, prior to the pandemic, our industry employed about 535,000 North Carolinians, about 11% of our state's workforce. Today, we have about 130,000 of those still on the sidelines. So, our focus is, how do we get those employees back into our workforce? We certainly don't want to lose them. They are, the people who work in our industry are people who love their jobs. They love serving people. They love the hospitality industry. It's in their blood. They want to come back. But there are a lot of reasons they can't, that prohibit them from coming back. And that's really what we want to talk about today is, as we work to get businesses to recover, what is it we do to make our employees feel safe and comfortable as they come back to work, to provide a safe workplace for them, but also to take into account that they have, families at home. They have real lives that they have to deal with during COVID-19. Many of them are caring for elderly parents, but a whole lot of them are caring for children who are at home. They don't have access to childcare. Schools are not in session. Those children, many of these parents, particularly women, have had to pivot to, providing. They're now educators. They're struggling with children who have very special needs as they're trying to, log on to computers and support education in the home place. There are just lots and lots of issues. And so today we are joined by a panel of folks who really are going to help walk us through this. And I want to introduce those folks to you. First of all, Emily Swartzlander, who is representing Family Forward North Carolina. They are a nonprofit here in our state that we've gotten to know fairly well at NCRLA. They offer support and services to businesses who want to become more family friendly. She's going to talk with us a little bit today about creative, innovative things that you as a business owner and operator can do to make that happen in your workplaces, about some of the unique things that they can, some of the services they can provide during COVID-19. And so welcome, Emily. Glad to have you with us today. We'll also hear from Jim Nadell, a human resources consultant with Performatier, who has deep experience in working with restaurants and hotels in an HR capacity. He's very well known in this sector across North Carolina, and Jim is going to bring to us some best practices and some great ideas of innovative things that we as an industry can do to facilitate healthy workplaces. And then finally, Steve Winch, who is co-owner of East Cut Sandwich Shop in Durham, one of our own, a restaurateur who has embraced some extraordinary best practices, not just during COVID-19, but during COVID-19, and has some great ideas and suggestions to share with us. And so with that, I will pivot, Emily, first to you and ask you to tell us a little bit about how you and your organization have been working with employers over the last couple of years to create, family-friendly policies and workplaces.
Yes, thank you, Lynn. And we are so excited to be here today and to be here with all of you. We appreciate your time. Just as by way of background, Family Forward NC is an initiative of the North Carolina Early Childhood Foundation. And the Early Childhood Foundation, in all of its initiatives and programs, really takes a holistic look at what children and families need to thrive across the state. And so you have worked on a number of different initiatives, both in the public and the private sector, to support all children and families. We know that the birth to age 8 time in a person's life is the most important from a developmental standpoint. And so if you get early childhood right, you are setting that child and future worker up for success through their lifetime. So Family Forward NC works specifically within the private sector, directly with employers, helping them to incorporate family-friendly workplace benefits, because we know from a lot of research, both nationally and on the state level, that things like paid leave, which is what you would normally think of, childcare support, flexibility, predictable scheduling, or schedules that workers know more than a couple weeks in advance. These are all things that not only have good business impact and help attract and retain employees, but also have lead to better outcomes for children. So we like to call it a win-win for sure. I think it's one of the few truly win-win situations out there. And we've been working with, we've talked to over 5,000 employers all across the state over the last few years, helping to incorporate family-friendly practices in a number of ways, mostly by showcasing folks like Steve, who've been able to incorporate within their workplaces and sharing data and best practices, HR support through Jim and Performenter. And when we got to COVID-19 and everything that happened within the hospitality industry, we've really been looking specifically at how is COVID impacting families and children, how is it impacting businesses, and how can family-friendly practices actually make you more sustainable and able to weather this ongoing crisis and kind of carry you as a business through to a better future and to tomorrow.
So Emily, tell us a little bit about, why businesses should embrace family-friendly policies. What's in it for a restaurant who suddenly says, yeah, we want to step up and do this. What's in it for them? Talk a little bit about that. What's your finding?
Absolutely. So what we've learned is that, in particular in restaurant hospitality industry, a number of things that were happening prior to COVID that actually still apply today. One of those is incredibly high turnover rate, which you all know. I don't have to go into that data. That the restaurant and hotel industries were experiencing very high turnover prior to COVID-19, and actually are still having trouble attracting, retaining, and bringing workers in today for a number of reasons. You touched on that a little bit, Lynn. One of which is childcare support. We know, just for instance, that 860,000 women left the workforce in September alone.
Oops, got Emily frozen
And
there.
then the number one reason, for
Oops, we've got some challenges, Emily, with your video feed. Okay, maybe now it's coming back. Okay, internet it froze up there for a minute.
oh goodness. Got it. But we know that, not only mothers are struggling, but fathers are also struggling with and being in the workforce right now. And so strictly from an attraction and retention standpoint, family-friendly workplace practices help to support your workers and therefore keep them in the workforce, keep them engaged with you. And frankly, many of these practices are very low cost or no cost and can not only encourage workers to stay with you, but encourage them to be more loyal to you and kind of hang in there through all the ups and downs with COVID. And so, we believe that it's very important for employers to look at these practices, and in many instances, most instances, is much more cost effective than losing someone and having to go through the process of hiring someone else. And I know Jim will touch on that later.
Good. Emily, I've been on lots of calls with lots of members across the state, and I was sort of shocked initially when I heard this from folks, because you look at, many of these restaurants are struggling to get back open and they're looking to, hire their people back. And then I hear from a lot of restaurateurs that they're having trouble filling vacancies, getting people back to work. As high as unemployment is in our state right now, you'd think people would be clamoring to come back to work. But I think you're right. I mean, it's not that they don't want to work, it's that there's obviously something else going on. And I think you've kind of hit on, what some of those issues are.
Yep.
Jim, let's pivot to you, and Lisa will, Emily will probably come back, but Jim, let's pivot to you and talk a little bit about some of the innovation and change that you're seeing out there from an HR perspective. What are businesses doing that are creative and innovative, that are helping to make workplaces successful in recruiting employees back and retaining them during COVID-19?
Thank you, Lynn. Thanks for inviting us and hosting this as well. There has been a lot of innovation that's come out of the industry and out of COVID for on many levels. I've seen it in revenue generation, we've seen it in technology, and we have seen it with some more empathy for employees. So I think, along the revenue generation side, there's definitely been a push for more takeout, but some of the owner operator adaptability has really been the key to their success, I think, during this pandemic. Many of them have looked at traffic flow and staging areas. Some have actually aligned resources or hired people specifically for their takeout businesses. Some others have sold menu items, prepared that customers could take home and prepare, and similar to a Blue Apron. Some others have been around packaging sausage and some of their retail stuff to sell through, like the produce box. So there's been some innovation there. Technology has always come into play, and we've been always lagging in technology based on our lower margins and sometimes our leased spaces, but cloud-based POS has came in and it's been a game changer, as has self-service kiosks and some of those things. And I think we're aware of most of the technology, but it's changing our business, and it's really changing our business because we're starting to employ a much more multicultural, multi-generational workforce that are readily able to handle and work with this technology. So we've seen a lot of also innovation around the employee empathy side. People practices have definitely changed, and we are all needing to do more with less, especially during this pandemic. So obviously we have a lot less employees on payroll, but we're becoming much more creative with how we're scheduling them. And that's been a necessary piece in order to keep our doors open. And we've been paying a lot of people with our PPP monies, but that's been long gone and we're waiting for some new relief. So right now it's a matter of cross training that's been happening. People are looking at their processes, a lot of the people processes within the business, and trying to make those more efficient. An example of that is a lot of the organizational models are being looked at and changed, and we're removing some silos. We're trying to flatten the organizations in hospitality in order to stay more competitive and meet the needs of the future customers and workforce for that matter. There's some examples that we've done too around where I've seen out there anyway is performancers helping with, we're offering like a safer, more compliant workforce, and we're helping employees feel safe in the workforce by offering a critical response line. I'll probably touch on that a little bit later, as well as some more communication strategies. I think that's one of the key pieces moving forward is operators that have established a better communication process with their employees, starting with COVID and being able to connect with them on a regular basis. But we need to connect with these employees how employees are looking to be connected with social media, with different apps, and with much more transparency. So we're working with a lot of operators on how to realign their communication strategies as well.
Good deal. Okay, thanks for that. Can you talk a little bit about, there's this issue around paid leave for employees. Are you seeing businesses offer paid leave when an employee has to quarantine? And then I've heard from some businesses that there's some challenges because I guess according to the Family First Act, though some businesses do that one time, employees are not eligible the second time. Are you dealing with that, or maybe somebody else on the phone can address that? Have you heard that issue?
I've heard some of that. I haven't seen it in practice too often. A lot of the businesses that we've been working with have been fortunate in that they haven't had a lot of close cases with COVID or having a lot to people to send home and actually enact that paid leave. But it is happening. People are offering more paid leave, for example, and not just because of the CARES Act. I think we're starting to understand the empathy for our employees. Family-friendly benefits are needed more than ever right now. And the empathy for the challenges our workers are feeling is really important. And I think people are starting to address that as best as possible. So the industry is changing for sure. And our employees is changing. So at Perform Mentor, we look at 4 integrating people practices, which talks about the, safe workplaces and the proactive communication, as well as growing talent. The last piece is people-centered resources. And that really speaks to the family-friendly benefits. So to get back to your question around that, there is a lot of paid leave being offered, and those that can't afford to do paid leave are offering job protection, which is critical for employees when they do have to take sick leave. The key is we don't want people coming to work sick and feeling badly and incentivizing them to come in, because that could be devastating to our businesses. So, we have to really offer them some kind of paid leave, and in some cases that's included paying them more up towards like living wage to be able to incentivize them to stay home and make it worth their while to stay home instead of coming into work. Many businesses are also offering PTO now too. That's been unheard of in the industry. And we're helping at Perform Mentor to customize some of these benefits for employees. So the old PTO was looked at around, everybody accrued something per hour, and then they were taking their vacation. We looked at it a little bit differently and tried to get a little creative with PTO, and that we have now people accruing at different levels for different reasons. We have incentives for people to take their time off at certain times of year. We're offering more blackout periods and utilizing that. Technology has really helped with that. Most of the HRIS systems are enabling a lot more communication between the employee and the employer as far as time off. But we're also getting creative with that, even paying a premium. One customer is paying a premium accrual for PTO for certain shifts. So for example, for weekend shifts, they're paying more accruals for that, which has really never happened before in the industry either. Which brings me to work schedules, which is also changing quite a bit. That's one of the family friendly benefits that is really of no cost. It's actually part of your business strategy in order to work with your scheduling a little bit differently. We're talking about predictive scheduling and flexible scheduling for the most part. And in some cases, the employees that we're talking about that can't come back to work really need to have some opportunity to work, and maybe giving them a shorter shift is an opportunity to get them back. Predictive scheduling also helps employees plan their entire life around their work. Instead of getting the schedule late in the week for the following week and having to be reactive to plan their life, knowing when they're going to be working helps them plan things like childcare and elderly care and some of the other. Some of are even taking on additional part-time work. So, the workforce of the future may be looking at multiple part-time jobs instead of working for one employer, due to the fact that not wanting to put all their eggs in one basket and a little gun shy for what's happening now. I also think, the earlier comment about people finding people to work is a little bit of that as well. They've just been through quite the horrendous time, and I don't think they felt really well treated as a worker in the hospitality industry. And that's where many of them are looking at other industries right now and haven't had an opportunity to do so. The other thing, with 4-hour shifts that we're seeing some of our customers doing is, as a business decision, instead of adding a full head count, if they're having a strong lunch business, for example, and working their employees from 8 to 4, they're now bringing in employees from 10 to 2. And it's a much different scenario, but we are finding people that can work that. The difference is with part-time workers, which I think is going to become a bigger sense of our workforce. We're going to need to hire more part-time workers. And I think that that's going to be really key in order to staff our businesses, but also to give the employees what they need and what they're looking for. So if there's an employee that has some childcare challenges, knowing they can work a couple hours is going to help them kind of re-enter the workforce. But the business side is getting employees to work when we need them during critical times. And there will be a part-time workforce out there willing to do so. The difference will be is how you recruit them. And there's definitely different recruiting strategies, one for part-time workers and one for full-time workers. And once we delineate between the two and start looking for full-time, part-time workers rather that want to work for you versus need to work for you, it becomes a much different employee that we're hiring. So
just
those are
Lynn, to piggyback, sorry, Jim, to interrupt, but just to piggyback quickly on paid leave, we did a survey with over 300 employers, and we're able to kind of parse it out by industry, and then look at the data overall, and saw that about a quarter of employers either have added or were planning to add paid leave policies of some kind because of COVID-19. So we are seeing some proactive change as a result of what employers are experiencing right now.
That's great. Thanks so much, Emily.
Thanks, Emily. Yeah, it's becoming a recruitment tool as well. I mean, I think in the future, as we're looking for hiring better and more employees, and the workforce is going to be more difficult to bring them in, those are some of the pieces that will actually attract employees and help us hire a little bit more. So I think that is pretty critical, as well as the flexible scheduling. Childcare is another piece that I know everybody is talking about, and there's a gambit of different things that employers can do for that, large and small. Hospitality is hard because we have much lower margins in there. So, what can we do? And, there are some opportunities. One of our clients is bartering with a local daycare center to work with drop-in care as needed for their employees. So that's one example that's fairly low cost for sure. And just as simply as looking at your attendance policies and reducing the penalty or the discipline for someone coming in late or someone calling out of work due to a childcare issue. It's okay to look at that a little bit differently, especially during this time. Obviously, if it happens, twice a week and everything else, then we have to take another route there. But, just being a little more understanding about some of the challenges that our employees are going through is really important. And then health benefits, which is, I think, another big piece of the recruitment side and what our employees are looking for. So, when you think about health benefits in the hospitality industry, that was a never going to happen kind of thing because of the cost. We're not talking about a Blue Cross Blue Shield health and welfare type policy. We're looking at some alternatives which are cost effective for sure and viable right now due to technology and due to the type of workforce that we're looking for. So, for example, at Performentor, we're offering our clients an employee assistance program called the EAP, and we have a pretty robust one that is offering several face-to-face counseling sessions for their employees and any household family members, and that's per incident. That also includes some financial assistance and debt management when needed. There's some other pieces around substance abuse help. There's some pieces around financial assistance, as well as wellness. And that we can offer to employees or employers rather for as little as $2 per employee per month. So it's very low cost, and it's a type of benefit that the workers today are accustomed to using and will utilize as long as it's marketed properly internally. Mm-hmm. Some other things that we can do is offer telemed to our employees. There are standalone telemed policies now that weren't there 5-6 years ago either. Right now, with everybody working from home and everybody kind of doing their social distancing, the usage of telemed has skyrocketed as well. So it's a much more acceptable platform for employees, and an employer could offer that for as little as $15 per employee per month. So you're covering a big piece of right there between the EAP and a telemed of employees' needs as far as benefits goes. And then many are adding on a catastrophic policy like an AFLAC to cover the, anything, God forbid, major happens, they're at least covered and know they're not going to bankrupt their family trying to, get treatment. So those three things alone can be offered for less than $30 per employee per month. And we have some customers that are looking at that and, getting creative with how they're offering that to their employees. Some are looking at it as the more full-time hours you work, the more that the employer will contribute to that $30 per employee per month. If someone's working, part-time hours, we could offer that less of that, or offer the employee to pay for that on their own, but it's still being offered. And these are things that are going to be retention tools as well. If I have benefits with my employer, I'm less likely to jump ship for sure. So that's another piece that's, I think, really, really important. We're working with some local vendors to make sure that happens. And a lot of our clients are opting for that as part of our service to be able to help them get those benefits too.
Very good. Thank you so much, Jim. A lot of great ideas and suggestions that I know some of our employers are already embracing, and others may be looking to do that. We appreciate you sharing your expertise in this area. Thank you for that. And now we're going to pivot to Steve, excuse me, in Durham, who at East Cut Sandwich Shop in Durham has embraced a lot of family friendly policies. And Steve, tell us a little bit, first of all, about your company, and then second of all, what you're doing and how you've implemented some of these changes.
Sure. Yeah. Thanks for having us. So East Cut is a local restaurant in Durham, co-founded by myself and my business partner, Brad. We are about 2.5 years old. Been operating since July of 18 in the University Hill kind of area in Durham. So just south of downtown, very much a neighborhood location. Really our key focus as a restaurant was to kind of provide chef-driven food at a value price point. The platform or vehicle that we did that with is sandwiches, obviously. So kind of incorporating the greatest hits of sandwich culture from up and down the East Coast, kind of tying in some of those global influences as well. And, a thing to note, given that we are more, I would say, of like a neighborhood location, is our customer base is heavily family oriented. There's a lot of, younger families, a lot of established families in our neighborhood that, frequent the shop a lot. So it's, we've incorporated a lot of family friendly practices, both on the customer side, but also, from our employee perspective. Yeah, in terms of family-friendly practices, I'd always like to start and say that, one of our core internal values as an organization is that we always put our employees first. And so the ways that we started with that, when we first formed and kind of codified policies and whatnot, obviously the biggest pillar of that was paying a fair wage for the work that folks put in. So in order to attract, but also retain, and also for folks to be able to actually support their families, we felt that that was going to be a really key part of our offering. Obviously, it wasn't going to be the only thing because we're also in Durham, and fortunately, a lot of people do pay a fair living wage. So with that, we also had always built in paid time off. It was initially it's actually something we're revising for the next calendar year to be a little bit more robust, which I think I'll get into a little bit further on. But paid time off for folks who had spent time with the company, who were full-time more than a year, we were doing that accrual for those folks. We've always had flexible scheduling, so we have a number of fathers and mothers, emerging parents in the team. And so we really, since day one, have always sort of had a pretty good flexible scheduling policy. There's some folks who are like, hey, I just want to have 30 minutes to go pick up my kid, drop them back, and I'll come back, or, making sure that we always kind of have set schedules as much as possible for those folks who need to go and take care of their families. And that's something we're constantly kind of revamping, trying to make sure that it's a tough balancing act. Obviously, 2.5 years ago, we would have never planned for a global pandemic that would completely disrupt how we operated as both a business and even like what our business looks like in terms of product mix and times of day. But we made that pivot pretty quickly. And then, yeah, I think the other key piece around safe workplaces, I think we made the decision pretty much right away when a lot of this started to emerge in March to just operate strictly on a takeout basis. So we have kind of rolled out a sort of very streamlined, I'd hope, curbside pickup process. So, now 98% of our business is done online. So all of that comes through, and we've essentially just decided that, in order to keep our team members safe, especially folks who've got kids and, they need to make sure that they can work and we can keep them safe. We've decided, even if there is some negative downside to revenue, we felt safety first was probably going to be more beneficial in the long run in terms of COVID. I think that's, yeah, the gist of sort of our initial sort of family-friendly practices.
So Steve, how many employees do you have?
We have 24 employees, probably about 30 to 40% of those are full-timers. And it kind of varies a little bit by season. So our busier months, which are typically spring, obviously COVID came right in the middle of that, and fall. So we're right now around that mark, 24 or so folks.
Good deal. And how has your business financially been impacted during COVID? Are you about where you are? You've made that up with just you picked up on delivery side, or are you off financially with that?
Yeah, it is not. Yeah, we were, so we were headed in a much stronger direction when basically from a few months before COVID, we were seeing month over month, year over year growth of 30, 40%. COVID hit right in our peak season, so we lost out on a pretty significant chunk of revenue from March through May-ish, when everything was kind of like very much buttoned up, and then it started to come back around. I mean, we're still off from last year around 25-30% at this time of the year, but from what we were hoping to be doing, probably down about 40% or so. Mm-hmm. But we can still, make a viable business with that. It's not where we want it to be, but our goals at this point are really keep the team safe, keep the business afloat, and figure out ways to still kind of progress with our our journey to make it sort of a good place to work and attract good talent as well.
That's very, very impressive. So are your employees, how do you feel like they're handling during COVID? Are they're comfortable coming to work? You haven't had any problems at all during COVID from them? They feel safe?
Everyone feels safe. Yeah. I mean, I think, obviously masks are on. Given that we don't have dine-in customers, we've been able to kind of spread things out more, started to use the dining room for more things. In terms of, I mean, like everyone, I'm sure there's been close encounters with folks. So we've had to have folks quarantine based on, someone that they either lived with. But thankfully we've been, knock on wood, good and internally. And we have kind of utilized the quarantine pay program as well from the
So maybe that question I asked earlier is best directed to you. So when they quarantine the first time, they get paid leave time, and that's through the government subsidy that you're able to tap.
Yeah. So the way the program's structured is they essentially get up to what a normal 2-week schedule would be for them. So if they're part-time and they work, 3 shifts a week, they are eligible for basically that amount of pay. And then likewise with full-time, it would be obviously whatever their full-time equivalent would be. If it happens the second time, I mean, some folks have kind of only had to quarantine, they would get a negative test twice, and then they'd be like, okay, that's good based on the CDC guidelines, and they might be able to use that. But the way it's set up is really just kind of have like, if you're full-time, you'd essentially have, what is the equivalent of 80 hours a week or so.
Right.
So if you are 80 hours a pay period.
So then they come back to work now, and they work a month, and then wham, they get notified that somebody, they've been in close contact yet again, probably not at work, probably somewhere else. But what happens when that happens a second time? Does the government subsidy, it doesn't kick in then?
No, yeah. If they've maxed out, like if they did the full 2-week, then there's no additional sort of benefit from the government, at least. Yeah.
So are you planning to pick that up for them?
For folks who have accumulated paid time off, yes, but it starts to get pretty costly over time, especially if we were in a different position, probably. But yeah.
Yeah, I mean, these are some real challenges that we're, hearing from members across the state, even those that are very, family friendly and are trying to do the right thing. The challenges are real, that even those with the very best practices, are facing some very real challenges. So Emily, we might pivot back to you a little bit. I know folks probably will have some questions, but talk to us about what family, what you guys, Family Forward, can do to help businesses. How do they reach you? How do they engage with you? What does that look like? And what are some of the ways that you can help with businesses, not only during COVID-19, but specifically during COVID-19, to help them be more family friendly? Tell us a little bit about the work that you all do to support folks like these.
Yeah, absolutely. And so, specific to COVID-19, what we have done is put together a couple of return to work kits that are available on our website. If you go to familyforwardnc.com/return to work, and I believe my colleague has put that in the chat, but if not, we will add it in the chat as well. And that walk you through some very specific action items that you can take, resources for you to have, ways that you can have conversations with employees, because so much of this is not only incorporating family-friendly practices, but then having those open lines of communication and really understanding what your employees want and need. Both Jim and Steve had touched on that. So in addition to the actual return to work kits, the workbooks, we've got a series of 3 webinars that are specific to the hospitality industry. And again, walk you through kind of step-by-step ideas and ways to implement practices. And then on top of that, through our funding support, we are able to offer no cost access to the team at Performentor, so that individual employers can work with the team there on specific challenges for their business. We know that many times there's an out of the box idea that might be needed, or a very specific challenge that someone is facing, particularly right now, as folks are trying to keep their doors open in this very uncertain environment. And so that is also available. And again, if you go to the familyforwardnc.com/return to work, you can find all those resources. You can find a way to connect with us to get that one-on-one support. You can get signed up for our e-newsletter, where we continue to share best practices and research. One of the things that we do is feature businesses like East Cut Sandwich Bar and some of the other employers across the state who are incorporating these practices. We've got case studies and kind of walk through how those folks have been able to incorporate, because we understand and hear from employers that learning from peers is very important. As you're kind of walking through what you need to do. And then outside of COVID-19, kind of through COVID and beyond, we've got our original Guide to Family Forward Workplaces, which walks through all of the practices that we have identified as having that dual good for business, good for family and child health. And that's just, again, available on our website, familyforwardnc.com. We have identified 16 practices that, again, range from scheduling to paid leave to childcare support, to accommodations for pregnant and breastfeeding workers, and really, again, practices that are big and small, have some cost and have no cost associated with them, and the data and policies, sample policies that you can use to adapt and incorporate within your own workplace, some surveys and ways that you can talk with your employees and suss out what may be needed, are all available on that site. So a lot of resources, a lot of data, and then that individualized help if needed.
So Steve, I'm going to come back to you in a minute, but I also want to call on somebody I see on the phone here, Sean Degnan. As you guys know, Sean made headline news when I guess his restaurant was the site of where the first case sort of spread in a public environment, and he and his team had to pivot pretty quickly. But I've followed him very closely as he's really embraced, I think, what are some best practices. And Sean, are you willing to share with us a little bit? You'll have to take yourself off mute. Some of the things that you all have done, and also I think you were trying to share a little bit about the government subsidy for leave.
Sure. Thank you for having me. Yeah, we got hit with the first case of COVID before the shutdown happened to us. Someone traveled from Washington State to Raleigh and ate dinner with us on a Saturday night in February. And we found out from DHHS and the CDC that next Wednesday. I had a friend actually at DHHS who let me know that they were headed our way in the morning. So I had time to like call Enviromaster and some other people to have the place cleaned. And we started out by telling the 2 employees that waited on the guest that they needed to go get tested. And then we called all the guests that were in that room with the person who tested positive. And then we told the public because it's impossible to keep that secret and counterproductive because we have 100 employees between 2 restaurants. So it was going to get out. So we told everyone. And then obviously we all shut down on March 17th. And before we reopened, we got together as a management team and we decided what reopening safely would look like. And we decided that the first thing we had to do was the paid time off. You had to be incentivized to, stay home if you had any of the symptoms, and the symptoms could be that of a cold. So we started with paid time off. We gave everyone 14 days paid time off because that's the incubation period, for COVID. And then the rate of pay needed to be that you would rather be at home and keep everyone safe than to come to work and accept, tips or anything. So we started paying everyone $15 an hour. And then we did an open enrollment for healthcare. And, as we hire people and as enrollment, comes around, I think ours is in January, people can sign up for a pretty affordable healthcare plan. We've done some other things. We learned a lot in reopening. That very first week, what we committed to was sustainable hospitality. And, we found out going through 1,000 pairs of rubber gloves on a weekend was not sustainable. So we put hand sanitizer everywhere and, washed our hands more like we used to, and kind of ditched the rubber gloves unless you're rolling sushi or running food. And yeah, I've actually met with Jim almost every Thursday since this all went down, kind of sharing what we learn each time. We've paid, I think something like 120 paid time off days. And I was unaware that you can get a tax credit for that. So thanks. Just that today will be enough to pay for itself. Yeah. And we've had no actual cases. We had one false positive scare last week or 2 weeks ago at Koan, our other restaurant in Cary. And we had every single person get tested and they were all negative. And then the person who, it was their cousin that had a positive test, he went and got tested again and got a negative. So probably our position going forward will have, instead of 50 people getting tested, have that one person go back and get one more test.
Right.
Because that's a lot cheaper.
Right. So Sean, are you making money?
We're probably at 75% of what we were. We didn't start out that way. When we first opened, we were making about 20% in sales and losing $20,000 or $30,000 a week.
Yeah.
But we did get some PPP money to kind of cover that. But we expanded our patios and that's kind of made up the difference during this time. And so we're doing pretty good, but the cold weather is going to impact us a lot. Right. And we've definitely spent all of that PPP money that was based on a 2.5 month payroll equation. We've spent that over the 8 months. So
we're hoping for another round of that. We're working real hard right now. Hopefully Congress will come back and maybe help a little bit more because good businesses like yours and Steve's have done the right thing and looked after employees, and I think that's going to yield great benefits. Thanks for sharing all that, Sean. Steve, let me go back to you a little bit. I think you mentioned that you've learned some lessons and that there may be some more benefits and things coming. Tell us about what that might be. You're an innovator here, and we're eager to learn, kind of what's next. What's the next step?
Yeah. For us, I mean, the big thing that we're kind of rolling out, so revising our PTO program. So it used to only apply to kind of salaried or full-time folks, but we're actually doing a new program that's kind of tiered. I think Jim kind of hinted at some of those a bit, but we'll also allow part-time folks to be eligible. We've also kind of converted it to kind of like true PTO. So it's not just like vacation time, but it's kind of whatever time. So it could be, one big bucket essentially for sick, personal leave, child leave, those types of things. The other big thing we're rolling out next year is healthcare. So, healthcare benefits, being able to offer that, we think is going to be a big thing and has always been on our radar. We were hoping to get to it earlier, but due to the shift and things, we had to kind of bucket it back, and we're feeling pretty confident how things are looking that, for next year, that'll definitely be a viable program. And then things like flex funds, there's some pretty cool packages that you can kind of offer that help people pay for things like childcare and things like that as well. And then, the EAPs are definitely something we've been looking at. I think most restaurant owners can confirm that there are definitely a lot of challenges as it relates to behavioral health and substance use with folks. And I think having an avenue to support our team members through those things as well. Yeah,
that's amazing. Just incredible and inspiring that good folks like you have stepped up and are doing even more now at a time that you're struggling with your own business and trying to generate revenue, which is why you're in business. But that you've taken such a keen interest on supporting your employees, and we all know that will yield positive benefits for you and for those employees going forward. So kudos to you and Sean and others who are doing great things. With that, I'll sort of pause and see if there are any questions, or Lisa and Emily, Jim, Steve, other things that we haven't talked about that you'd like to share, or if there are questions from folks. Anything we haven't talked about?
While we're waiting for any questions, I do just quickly want to touch on something that Steve mentioned about flex accounts and any type of support that employers can give for childcare. I know many times when we speak with employers and mention childcare, it sounds so big and like something that would be very difficult for an employer to tackle. But there are so many ways that employers can help to provide that childcare support that that aren't necessarily having a childcare facility on site like a large corporation would be able to do, whether it's dependent care savings accounts and some flex spending accounts, or whether it's just an additional boost and some subsidized care, or whether it's working with a local care center to ensure that spaces are available for your employees that they can then pay for themselves. A number of different ways that you can help to provide childcare support to employees. And we do know that really is for many employees is a real sticking point right now, and will continue to be as schools continue to kind of through their different phases and ramp up and ramp down, and as quarantine continue to happen for within classrooms, which then affect families. So don't be afraid of childcare support, and know that there are a number of different ways that you can jump in there. We've got a couple of organizations that we work with, and they're on the website, but in particular the Child Care Services Association, that can work directly with employers and again help them identify personalized plans to help their employees with childcare support. So don't be nervous about it because it sounds big. There's a lot that you can do.
Very good.
Yeah, and Lynn, this might be for you, but I think one thing that I think would be really important for our public leaders to help push and solve would be, with paid family leave, for instance. I know that there were discussions for a while about rolling those things out, but I think, some sort of way to credit or subsidize paid family leave, I feel like should be like front and center on the table for the Congress or for NC or whoever. And likewise, like better ways to subsidize healthcare, especially for the hospitality industry. I mean, healthcare is not cheap in this country. It can be, if you're trying to offer a pretty good plan, can cost upwards of several $1,000s per person per year. So yeah, I mean, I think those two things from like a legislative perspective would be really helpful. And then we actually didn't use the PPPs. We used the ERC, so that employee retention credit. We
Right.
found that program to be very helpful, mostly because we didn't have to worry about like, what's this window of time? What's the loan look like? And we can kind of use that throughout the course of the year with our team members as well.
Yeah, that's great.
I feel like that was a good program.
Yeah, so as Congress comes back here after these contentious elections that we've all experienced, it sounds like, they're really, for our industry, they're going to be looking at three things. And one is another round of PPP, which is something they know and understand. And maybe it wasn't perfect, but it's kind of the devil they know. And so that's the easiest path. But they're also looking at the ETCs as well. And I think we could see that come back again, which would be very helpful for folks like you, Steve.
Yep.
And then there is the Restaurant Act that still has some life left in it. And we've been continuing to push with that. It's just so industry specific. I think that the opportunity to get that passed may not be as great as something that's broader and more holistic and serving, all kinds of businesses. So we're going to be pushing hard for that. And we hope that, Congress will step up and do the right thing. Because I know it's not easy for you all, but I'm just so impressed. And with that, I'll pause. I've called on Sean just from in the audience, just because I followed his story so closely, and I'm just so in awe of the work that he's done. And Steve, hearing about the work that you're doing to support employees. I wonder if there are others on the phone who have things that they're doing that they'd like to share or questions. Steve, I see you've just had another great idea, or you're sharing there, but you're saying one really good way to help employers who sign up and are exhibiting best practices would be to connect some government-sponsored catering, food insecurity programs to restaurants and that are doing the right thing. I think that's a great idea. We are gearing up right now at NCRLA to go into this upcoming legislative session that will begin in January with a new legislature. And we're in the process of developing our legislative agenda. So I think a lot of the ideas and suggestions that you all have brought up here are really, good considerations. I think one of the things that we as an industry tend to do is to embrace family-friendly policies like the things that we've talked about, but to do so that they're voluntary, that businesses like yours, Steve, and like Sean's, you've set the example for how you can voluntarily do these kind of things. And then if we can supplement that with some incentives to businesses, rather than mandates to businesses, it might be better received and there might be some real benefit for us. So I think that's been really educational for me in this process, and definitely something we'll keep in mind. And I may follow up with you all too, just to see how that may work as we develop these policies. Jim, I'm going to pivot back to you real quickly about the healthcare options that you talked about, because it sounds like you were referencing some healthcare options that might be something that businesses could implement sooner rather than later. So maybe it's not the full-blown healthcare program.
Right.
What are the costs for something? You talked about maybe up to $30 a month per employee.
Yeah, thanks, Lynn, and I'm happy to do so. And the thing I was going to add also is that, all the clients that we're speaking with, especially in hospitality, it is overwhelming when we start to think about, what things we have to do for our employees and where we've come from, and, hard to see where we're going to end up. But I think the message for everybody and for some of your members too, Lynn, is around every one of these businesses are different, and every one of the solutions for those challenges that they're facing is a customized approach. And it's not one size fits all, it never will be. But once we kind of peel back the onion a little bit and start looking at the specific challenges, there are some solutions that we've been able to find and to support. So that's that's one thing I wanted to add. As far as the healthcare and the health benefits, yeah, it's there's a few brokers that I'm working with and performancers worked with in the past that are trying to pull together some of these packages that are and package them all together. But I think it's looking at also the need of the employee. So a lot of those needs are covered by some of the examples I just shared with an EAP, some telemed, and a catastrophic policy. Instead of going with the basic health and welfare benefits. I think it's good to offer that, but I think you're going to find a lot of employers are having a hard time picking that up. So this is a way, from my standpoint, from a recruitment and retention tool as well. But it could be done. The EAP is extremely inexpensive at $2 per employee per month, and the telemed and the catastrophic come in around 15, maybe a little bit less per employee per month, depending on a couple of variables and how deep you get with some of those benefits. But in general, it's fairly inexpensive from that standpoint compared to health and welfare benefits.
And Jim, are you finding that most businesses who are doing that you talked about, are they having the employee pay a portion and the employer pay a portion, splitting that up?
Yeah, it's a split. I don't have that many clients that are adopting this. They're kind of more inquiring, and we're starting to set it up with more employees now. But in general, what they've been doing is for full-time people, they've been covering it. For part-time people, they've been covering a percentage of that based on hours worked. And that's been generally the approach that they've had. But yeah, it's been interestingly and well received thus far because it is a little bit out of the box.
Very good. Thank you all so much. So we're approaching the top of the hour here. We've got just a couple minutes left in case there are any last minute questions that I've missed. Lisa or Emily, who are coordinating things for us here today, anything we've missed or any questions that I've missed in the chat box?
What I would just say, Lynn, is, there's an opportunity for everybody on the call and anybody that logs into the for North Carolina website to complete the survey and sign up for some amazing free consulting time from us at Performancer that can really help get things started. And it's a conversation that just needs to happen. And once we do engage in that conversation, several customers that have taken advantage of this are finding it's not as unsurmountable as they first thought it was. So we can definitely help in that area.
That's awesome. Well, this has been very, very informative today. And again, as a reminder, I know it was in the chat box, but I'll just mention one more time that you can go to the website, www.familyforwardnc.com/return-to-work, and get lots of information and figure out how to access and partner with these folks who have shared so freely with us today. I thank you all for being with us and look forward to continuing this conversation as we try to navigate our new normal. Our normal. It's no longer a new normal. I think it is now our normal. So thank you all so much and have a great rest of the week. Bye-bye.
Yes.
Thank you, Lynn.